Welcome everybody to our new discussion, tubercular meningitis. As you know, we have the three types of meningitis mainly. They are bacterial, viral, and fungal. On bacterial, tubercular meningitis is another important topic of discussion. So let's talk about tubercular meningitis. So tubercular meningitis usually arises from the formation of this metastatic caseous lesion in the brain parenchyma or cerebral cortex or meninges. So that develops during a lymphatohematogenous spread, the lymphatohematogenous spread from the primary infections. So this results gelatinous basal exudate, which interferes the normal flow of CSF. So most of the time the in question they use this basal exudate. If you found this term basal exudate, you should suspect as a tubercular meningitis. So out of the ventricular system at the level of the basal cisterna, this basal exudate leading obstruction, but this obstruction leads communicating type of the hydrocephalus. So what are the clinical manifestation of the tubercular meningitis? So clinical manifestation of tubercular meningitis, we have there are three stages of the tubercular meningitis. First is this prodromal stage. So prodromal stage basically called as stage of invasion, in which insidious onset of low grade fever and loss of appetite generally present in the prodromal stage. So the second stage is called as stage of meningeal irritation. So during stage of the meningeal irritation, few signs are present like neck rigidity. As I discussed on previous video, there are two signs of the meningeal irritation. One is the neck rigidity and another is cornic sign. So stage 3 is known as the stage of coma, during which the loss of consciousness and pupils are dilated and fixed, and episodic deceleration occur. So CSF finding of TB meningitis, I have already discussed about this CSF finding of tubercular meningitis. Basically sugar is low in bacterial meningitis, as in all bacterial meningitis. In TB meningitis also low sugar is there, and there is high protein. In tubercular meningitis, protein level is very high, and the predominant cells are lymphocytes with low chloride levels. So what are the complications of TB meningitis? There are they may be in fact in the brain. There may be in fact in the brain and okay, so in fact in the brain due to the vascular occlusion, and which lead to the various manifestation seen in the TB include the hemiplegia in 20%, quadriplegia in 19%, and monoplegia in 20%. So cranial nerve palsy is seen in the 14%, and ptosis and ophthalmoplegia and decerebration and decorticated rigidity may be present. So let's talk about viral meningoencephalitis. So what is the most common organism causing the viral meningoencephalitis? You should know the enterovirus. The enterovirus is a most common organism causing the meningitis. So other virus causing this meningoencephalitis are herpes simplex virus 1, herpes simplex virus 2, and HIV-16, and Varicella zoster virus, and the mumps. The CSF examination of the viral meningoencephalitis shows the cell is the lymphocytes, and the glucose level maybe it's normal maybe it's most of the time it's normal, but in all kind of other type of meningitis there is decrease in the glucose level, and the CSF pressure is elevated and normal or slightly raised protein in the viral meningitis. So HIV usually affects the temporal lobe of the brain. So causes of the focal and causes the focal seizurous protein. So low levels of CSF may be high, usually viral meningoencephalitis, and CSF protein level is normal or slightly increased. So herpes simplex 1 affects the children and adults and causes the focal involvement, unlikely other viral infection. So herpes simplex 2 affects the neonates. The herpes simplex 2 affects the neonates and causes the involvement of the brain. So varicella zoster virus causes the cerebral ataxia. This is another important point. So you should memorize this term. So mumps causes mild disease and hearing loss can be seen due to the nerve damage. Unlikely other viral infection, CSF glucose is low. So HIV 6 mainly affect the immunocompromised patient. So seizure. Let's talk about another important topic, seizure. You should know the seizure definition. This is the abnormal excessive electrical discharge from the brain. So seizure can be classified into two terms: generalized seizure or this partial seizure. So generalized seizure can be further classified into the absence seizure, myoclonic seizure, tonic seizure, and generalized tonic-clonic seizure and atonic seizure. Partial seizure is and there are two types of simple partial seizure and complex partial seizure. So you should know about the simple and complex. In complex partial seizure there is loss of consciousness, and this complex type of the partial seizure present in the temporal lobe epilepsy. So another important topic of discussion is febrile seizure. In competitive examination they will definitely ask questions from febrile seizure. So you should memorize some important fact about the febrile seizure. So febrile convulsions are the commonest cause of the seizures during this childhood time. So the time period is important. This is because most of the time they ask the time when it is present. If this is generally present between the age of 6 months to 5 years, the convulsions are related to the degree of the temperature rise, but are the frequent if temperatures rise abruptly above the 39 degrees Celsius. So spontaneous remission occur without no post-ictal deficit and EEG changes, and few days after the seizure is normal. So recurrent febrile seizure occur in 30 to 50% of the cases, and more than 90% of febrile seizures are generalized. So what kind of the seizure is present in the febrile seizure? You should take the term called as generalized type of the seizure is present in febrile seizure. So acute respiratory illness are most commonly associated with the febrile seizure. So there are two type of clinical features in the febrile seizure. The type of seizure, you can say type of febrile seizure. The simple febrile seizure, this is usually seizure which lasts for less than 15 minutes and generalized in nature and no post-ictal neurological deficits. So complex is the atypical, which is occur more than one seizure occur in same day, which is lasting for more than 15 minutes and is focal in nature, and there is no post-ictal neurological deficit, is called as the complex atypical febrile seizure. So what are the risk factor of recurrence of the febrile seizures? they are like positive family history. If family has a history of the febrile seizure, there is chances of the recurrence febrile seizure. So if seizure like is a atypical and complex type of the febrile seizure, then there is chances of the recurrence. So if more than one seizure in the same day and which is lasting for more than 15 minutes, it is called as complex febrile seizure. So if febrile seizure occur in the less than 1 year of the age, then chances of the recurrence. So neurological neurological and developmental retardation, developmental delay, then there is chances of the recurrent febrile seizure. Children with the convulsions are at least risk of the at increased risk of the developing epilepsy in the future. It may like 2 to 7% of cases. So let's talk about the investigations of in febrile seizure. If like less than 12 month of age, we have to rule out meningitis. So LP is indicated. If like more than 12 month of the age, no investigation is required. So treatment, how to treat the febrile seizure, this is an important topic. So you should know the how to treat this febrile seizure. So basically the temperature reduction is a primary mode of treatment in febrile seizure. So you should give antipyretic, paracetamol or ibuprofen, which is the most important measure. If seizure lasts for more than 5 minutes, and so you should give diazepam, rectal or IV, is an anticonvulsant of the choice. So phenobarbital can be used as a alternative therapy. So for prophylaxis, to prevent the recurrence of febrile seizure, we can use intermittent prophylaxis. The intermittent prophylaxis, the drug of choice is diazepam. If failed intermittent prophylaxis, you should use this continuous type of prophylaxis. The drug can be used as sodium valproate or phenobarbital. So carbamazepine and phenytoin are the ineffective for the prophylaxis. So main measure is temperature lowering, is sponging and the antipyretic, and paracetamol has no role in the prophylaxis of this febrile seizure. So let's talk about another important topic called as myoclonic epilepsy. It is characterized by the brief muscular contractions with the loss of body tone. It may be infantile spasm or it may be juvenile myoclonic epilepsy. So in juvenile myoclonic epilepsy, it is also called as infantile spasm. There are the occurrence of time is generally between the age of 3 to 8 months of life. So there are two type of signs present in juvenile myoclonic epilepsy, all caused as salami spells and mental retardation, and the tip Sari mean pattern of the EEG, in which the diffuse high voltage slow type of spikes and chotic activity is present. So spasm occur in clusters are usually in waking. So prognosis of the normal mental development is poor, and vigabatrin is the drug of choice. This is another important topic and fact, that is the drug of choice for the myoclonic seizure is the vigabatrin. If not in option, you can take this ACTH is a second drug of choice, and corticosteroids can be used in the treatment of the myoclonic epilepsy. So juvenile myoclonic epilepsy is called as Jan's syndrome. So it is begins in the early 12 to 16 years of the age. It is characterized by the bilateral myoclonic which occurs most frequently in the morning after awaking. So it can be provoked by the sleep deprivation, and consciousness usually preserved. it is actually the clonic type of the seizure. Generally, in febrile seizure, there is present of generalized tonic-clonic type of seizure, but in juvenile myoclonic epilepsy, also generalized tonic-clonic type of seizure is present. But in absence seizure, it is present in the 1/3 of the cases only. So it begins. It is a benign conditions, and although is a complete remission is uncommon. So EEG shows they 4 to 6 hours of regular spike wave discharges. This is another typical point on the juvenile myoclonic epilepsy. The family history of epilepsy is positive in most of the cases, and seizure responds well to appropriate anticonvulsants. So valproate is the drug of choice for this myoclonic epilepsy. So valproate is the drug of choice for the myoclonic epilepsy. So neonatal seizure. So most prominent feature of prominent feature of neurologic dysfunction in the neonatal period are the seizures. So subtle seizure, the most common type of seizure in neonatal period is subtle type of seizure. This is another important question, and they will ask in the question. So this subtle seizure is a most common type of seizure present in the neonatal period. This is characterized by the movement of the upper lip, boxing, hooking, and swimming, and the lower limb bicycling type of the movement, and sucking of lip, and smacking, and apnea. The focal seizure have better type of the prognosis, after the subtle seizure, which carries the best prognosis is focal seizure. So what are the causes of the neonatal seizure? So if in question, what is the most common type of neonatal seizure causes neonatal seizure, you have to write this hypoxic ischemic encephalopathy. HI is the most common cause of neonatal seizure. But what kind of seizure is most common? You should take subtle type of the seizure is the most common type of seizure in neonatal period. So other causes of the neonatal seizure like intracranial hemorrhage, hypoglycemia, hyponatremia, pyridoxine deficiency, drug withdrawal, bilateral familial neonatal seizure, infections, hypocalcemia, hypomagnesemia. The hypomagnesemia is the better prognosis in the seizure. The disorder of amino and organic acid metabolism, hyperammonemia, developmental defects, and idiopathic, which has the bad prognosis among the causes of the neonatal seizure. So, drug of choice for neonatal seizure, phenobarbital. Phenobarbital is a drug of choice for this neonatal seizure. So, if in a question, if they ask what is the drug of choice in neonatal seizure, you should write phenobarbital. And this phenytoin is the alternative drug of choice. So by this discussion, we have just finished our discussion on this febrile seizure, juvenile myoclonic seizure, and we'll discuss more about CNS in our next topic of discussion.